More than 8 million people are estimated to have it by 2030. It is heart failure. Now more than ever in light of COVID-19, people are focusing on their health and how to take better care of themselves in general. And here to help us today with that, Dr. Mikhail Kosiborod. He is from a cardiologist from St. Luke's Mid-America Heart Institute and VP of Research at St. Luke's Health System. Dr. Kosiborod, thank you so much for being here today.
Thank you for having me.
We do hear the term thrown around, heart failure, and to be honest, I'm not sure I even know what the difference is. Why is that so confusing to many people?
Well, you're right, it is a confusing term. Just imagine if you're a patient and you were just told that you have heart failure, what probably goes through your mind is, my goodness, my heart has failed, it's not working anymore, and am I going to die tomorrow? It's a very scary and kind of ominous term, and of course anxiety-provoking to patients. And what's important to keep in mind is even though it is a serious condition and can be associated and lead to a bad prognosis, there is lots that can be done to prevent it, lots that can be done to treat it and improve that prognosis. And it's not that your heart's failed or stopped working. It's not a heart attack or cardiac arrest, which sometimes gets confused with heart failure. It's a chronic condition that essentially means that the heart muscle is not pumping the blood as efficiently as it should. And so the ability of the heart to get the blood to vital organs and tissues is not as good as it needs to be.
Those statistics I just recited at the top here, they're startling. So is it that we are seeing more heart failure, or are we hearing more about it because of its relationship with coronavirus?
Well, we're definitely seeing a lot more heart failure, and that was going on for, way before, long before we had this pandemic of coronavirus. And the reason we're seeing more heart failure over time is partly because we're getting older as a society. Age is a big risk factor. Unfortunately, not much you can do about your age. But there are lots of other risk factors we can do something about. And these are very common, highly prevalent health conditions like high blood pressure, for example. Controlling blood pressure can be done effectively and can reduce the risk of developing heart failure. Diabetes is another health condition that's a big risk factor, and there are lots of others. So bottom line is, yes, we're seeing a lot more heart failure. It's actually the main reason people get hospitalized nowadays in the United States, but there is lots that can be done to prevent it, and one of the best ways to prevent it is to manage the risk factors, some of the health conditions that I mentioned before.
I think a lot of people forget that there are so many other conditions that can be interwoven and linked to heart failure. So how can we learn more? What should people be doing now so that we're not setting ourselves up for just what could be nightmarish health?
Well, you're absolutely right. There is lots that we can do. So the best way to deal with heart failure is to prevent it from happening in the first place. And the best way to prevent it is to talk to a doctor, trying to understand whether you have risk factors for heart failure. If you do, make sure those are well controlled. Now, what do you do if you've already been diagnosed with heart failure? And actually, even before I get to that, I would say, you mentioned coronavirus pandemic before. One of the things that's really important is if you have any warning signs consistent with heart failure, things like breathlessness, not being able to exercise because you're fatigued or short of breath, developing swelling in your ankles, not being able to sleep at night because you're short of breath. Make sure those get addressed right away, because they can be warning signs of heart failure. And while some folks have been trying to avoid medical care because they're understandably scared of coronavirus, if you have any of those, that really needs to be addressed right away. Now, if you've been diagnosed with heart failure, the good news is, while it's a condition that has a poor prognosis, that prognosis can be greatly improved with various treatments. Some of those are like diet and exercise, always help, but there are lots of treatments, some that have been around for some time, even decades, others that are just recently becoming available. And the important piece of information that just recently become available is that if you are optimally treated with those medications and those treatments, you can add more than 6 years of life to your life expectancy. I mean, that's amazing that you can live for 6 more years and enjoy time with your family and your loved ones, and not just live longer, but also feel better. So both have better quantity and better quality of life. So absolutely talk to your doctor about what treatments may be right for you, and make sure that if you have heart failure, that you take advantage of that. And frankly, that's one of the reasons that I partnered with AstraZeneca to raise awareness of why heart failure is so important and all the different treatments that can be available to treat it.
Okay, thank you. An interesting conversation. We appreciate it. So thanks to innovations in research, technology, and available therapies, there is now hope, even for patients with advanced heart failure.